The ethical principles we are launching today are a groundbreaking document because now, for the first time, our global associations have a common and concise set of shared principles. They will apply to more than 30 million professionals, civilian and military, who may face ethical dilemmas in times of armed conflict and other emergencies.
The text as such is the proof that you can bring healthcare providers together, take 4 major organizations and make them agreeing on a basic set of principles. So the day they can sit together and do the same at the ground level in relation to each of the contexts in which they are working, then we will be able to find solutions. Because, as I said, none of us alone is able to solve the problems.
All 4 organizations that are represented here today are the authors of the document, so we are very lucky to have all 4 of you, and they have adopted this common document within their organization. And since this adoption, the International Federation of Medical Students, the IFMSA, has also adopted it. It's the first organization beyond the authors to endorse the principles, and we hope many more might join.
Be it in Yemen, Mali, or Syria, doctors and nurses are exposed to threats and violence aimed at thwarting their medical duties every day. And within the constraints of armed conflict, they too often find themselves confronted with acute ethical dilemmas and, until now, without much guidance. Existing norms are no longer sufficient, and the general consensus that the medical mission has to be respected in all circumstances has slipped into the background while abuses have increased from sporadic to systemic.
For us, it was a very easy option to throw our weight behind this because nurses and doctors and other health professionals are often the subject of terrible abuse and violence, because the feeling was that if you attack or frustrate the activities of one nurse, you actually frustrate and attack all of us.
Over the past years, we have found that many of those regulations, which some people, including me, thought were common standard and a totally common understanding in this world, were not. What we found that increasingly health personnel, physicians, and other health personnel was attacked, medical institutions were abused or were under fire, and that the rules that we thought were taken for granted by everybody were actually not observed anymore, or at least observed than before. This tendency, unfortunately, has been rising over the past years, and we found it more and more necessary to raise our voice in both directions, as well to the perpetrators of conflict, which didn't observe the science and the regulations that have been made and brought forward by the different conventions, as well to our own colleagues, which we had to tell that medical neutrality is essential for the work of the health workforce, especially in times of conflict and violence.
And I think the value of the ethical guideline is to remind that we have a delegation of power to act in the best interest of the patient there. If you don't have any ethics, you cannot say it's wrong. Once you get a reference that you can compare it to your own practice or what you see around you and say that's wrong, then you can able to speak up.
Just to recall that it means healthcare personnel shall provide care with humanity, respect for dignity, and no discrimination. Healthcare personnel must never be involved in acts of torture or any form of cruel, inhuman, or degrading treatment. The primary obligation of healthcare personnel is to their patients, which entails inter alia respecting the patient's right to confidentiality and their privacy. Healthcare personnel are afforded special protection while performing their duties, which must be respected by all, and they shall never be punished for executing their duties in compliance with legal and ethical norms.
overall, this ethical principle has also a key value. It's to provide confidence to the different healthcare professionals in their positions, in the fact that they shall not be a target. And therefore, in many cases, one can see that health can be considered as a power, whereas in fact it should be more considered as a right and a collective responsibilities. And so when you shoot at healthcare professionals or healthcare facilities, that is when you try to only look at the power side and not the collective responsibilities. And that is also denying the fact that if you really want to put patients first, the only ways you can do this is to also ensure that there is healthcare professionals, because ultimately you cannot achieve any health without healthcare professional there. So overall speaking, I think it's about these ethical principles ensure or improve the resilience of health systems by providing them the ground that we can help, we can based on lobbying activities, advocacy activities around the different stakeholders to effectively improve the situation.
And of course one would say, well, why don't you first turn to the perpetrators of the violence? Those are the ones you have to address, because they are the ones who are killing the people, they are doing the violence, and not those ones who are sitting in the field lazaret or in the clinic and in the hospital who are doing the work there. So there seems to be a logical break. But that indeed is not one, because what we need is, we need a very clear environment of rules for those who are working in this environment, because they themselves feel unsafe. They don't know what to do. They have to know how to treat the different people coming in, friend or foe. Can they really treat them the same way? This is a question for many of those working there. And yes, we say you have to give them equal treatment, no difference. And then there's a commander behind them, or a chief who says, no, 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 my people first, my soldiers have to go back into the field, or our people are more worth than others. And here comes in place what these rules mean. These rules say, no, there is equal treatment that is necessary. And it entitles you to say no to your commander, to say here is that what is accepted by the international community, to say this is the way we go.
And now it is of the utmost importance to give this document the most wide distribution as possible. And I see 3 levels for this. First, this document has to be distributed, and the information about this document has to be given to all the military and civilian health personnel to the lowest level. Secondly, the document has to be given to the military and civilian authorities of these people, so that they can accept that their people act along the principles of this document. And third point is that this document has to go to all political authorities who have the power to persuade people about the necessity to protect health workers who are doing their regular job. And there is a 4th level, but that is the most difficult level. This document should be distributed also to non-state actors, because there are big problems for the security of the health personnel.
It's important that we do not neglect our education colleagues as part of this process, because laying a strong foundation is very important. So from the very outset, we were very encouraged in some of the developmental work we've done as part of the Healthcare in Danger project to produce educational resources that can then be readily used in both the student setting and in continuing education to refresh people's memories.
The ICRC is raising the issue in multilateral fora, both regional and global, not only to increase awareness, but to get states to take concrete action. Now that all major professional organizations have come together, we expect states and international organizations to offer political support to our efforts and to use all means available to facilitate their implementation.
Thank Thank you very much. Very, very rich indeed what is coming. Maybe can I just try to extract some of the things that came very strikingly from all interventions. I mean, this notion of same ethical rules in peace and conflict obviously is very strong. You all said it was a very easy process. You all have your own, of course, your own work on ethics related to healthcare in your own organizations. But interestingly, it comes as a notion of common language, of dialogue, which is enriching your own practice and your own thinking around the issue. And by mobilizing this wide community, I mean, not to forget that you represent 30 million people, the four of you around this table, which is quite amazing, I find. This gives an amplifying notion to the voice of on these ethical principles. Thank you very much for having joined us and wishing you all the best for the rest. Thank you to help us create the buzz.
Thank you.